Welcome back, everybody, to Leading Experts. I'm Grayson Foster. If you're just tuning into the show, my guests today are two of the leading specialists in cosmetic and general dentistry, Dr. Marc and Dr. Eli Schwartz. Dentistry has been a family tradition for over 100 years in the Schwartz family. Dr. Marc is a graduate from Ohio State University with honors and has been practicing for over 32 years, and his son, Dr. Eli Schwartz, is a graduate from Nova Southeastern College of Dental Medicine. We've been talking about general dentistry and certainly cosmetic dentistry. All right, guys, I'm sure you see a lot of baby boomers in your practice, in your area. What kinds of dental issues are you seeing there? What are the trends?
Well, the trends today are people want to look younger, they're living longer.
Yes.
They want to have a brighter, straighter smile.
Right.
That's the basic trend. You know, people years ago, I would say 50 years ago, by the time somebody was 50 years old, they had 6 to 10 teeth remaining.
Right.
So teeth used to, the fillings and procedures that were done lasted a lifetime because you didn't keep your teeth.
Yeah.
Now today, people are keeping their teeth a lifetime, and you can. So as we age, our teeth get a little more crooked and a little more stained.
Yeah.
So today, people want brighter, straighter teeth.
Yeah, absolutely. My mom's in her 70s and she just redid her mouth a couple of years ago, and it's amazing what a difference what it makes.
Yeah, it makes you look younger.
Yeah.
Makes you feel better.
And she feels so incredible, and she's so happy she did it. And everyone's like, oh, you're in your 70s, you don't need to do that. But it's true, and she looks great.
I have a lot of older patients, 60, 70, even almost 80, that do smile makeovers.
Yeah.
Because they want to feel good about themselves.
Of course.
Not bright white like a refrigerator.
Right, right.
But they want it to look nice.
All right, the next topic is whitening. It's so pushed in the media and on television. But how do you know what works? Does stuff in the drugstore work at all, or are you best just to come and see you guys for the whitening?
Well, the material in the stores does work.
Okay.
The problem is some works better than others.
Right.
And what we have in offices is a product that we know the consistency of the product is always the same. And more importantly, people who get products over the counter without being screened first, many times burn their gums because they don't know how to properly use the product. So really, the best way is to have the dental office guide and supervise and help people get their teeth through the whitening process.
Okay. Something else that's a great advancement is Invisalign braces. And I want you to talk about that a little bit, Eli. And you did this yourself?
Yeah, I actually had them done on myself. I wore braces when I was young.
Right.
Okay, of course, like most people,
Yes,
I didn't wear my retainers. My teeth got crooked again. So I thought, well, we'll see how this works. It's pretty easy.
Yeah.
So it was very simple. You just do what's told, and it came out great. My teeth are straight.
Yeah.
I finished.
Yeah.
Okay. We have a lot of patients that want straight teeth, and they don't want to go to the orthodontist, and they don't want the braces. They don't want the brackets on their teeth.
Right.
You know, they think, oh, that's for kids. They don't want that now that they're adults.
Right.
So it's a very easy way to straighten people's teeth, and they don't see the brackets on their teeth.
And they're just a series of clear trays, is that correct?
Yeah. If anybody's ever seen like a whitening tray or something like that, it's a clear plastic. It goes over your teeth, and it moves your teeth just like braces would.
Yeah. And how long does the process take, generally speaking?
Generally, it takes usually between 6 and 12 months.
Okay.
Obviously, some people are a little longer, some may be a little shorter, but generally, it's not usually a 2 or 3 year process like braces
can be.
is.
Yeah.
Right.
You did bring a couple of your cases with you. The first one is a video testimonial from your patient Ellie, so we're going to look at that right now.
Great.
I've been a patient of Dr. Schwartz since 2003. I came here for Invisalign. I used to have a tooth that used to stick out, and my lip used to get cut up every time I smile. Since the treatment, I've been a lot more confident. I no longer have to put my hand over my mouth because I'm embarrassed to smile, and I get nothing but compliments about my smile and how perfect my teeth look.
She's a great testimonial for you. And now we're going to take a look at her before and after photos really quickly.
Yeah, as you can hear, this area on her mouth, these teeth right in the front of her mouth, were so out of position, and it bothered her so much, you know, and people don't realize how easy it is to fix something like that.
Yeah, because there's
without having to go to the orthodontist and wear braces.
Yeah.
So all we had to do was have her wear those trays. She came out beautiful.
It's gorgeous. I mean,
and it's easy, and
I mean,
it's amazing.
She looks like a veneer case. I mean, her teeth are beautiful.
You can see how much more she wants to smile
yeah,
now. That's
of course.
the thing. They're so much more confident.
Yeah, it's incredible.
It's things that have been bothering people for years.
Right.
And they never do anything about it because they think the only thing they could do is wear braces, and that's just not true.
Right.
And one of the other side aspects of Invisalign is many times we have them do whitening at the same time they're doing Invisalign because they have the trays.
Yes.
And they just put a little bit of that gel in, so not only are they straightening, but they're whitening at the same time.
Now, this is a case that you worked on, Dr. Marc, and that was Wendy, right?
Yeah, Wendy. Now, Wendy has a really interesting story. Wendy has been a patient for many, many, many years, and I used to ask her, Wendy, how do you feel about the appearance of your teeth? And she would start to well up, and tears would be coming down her face. I said, well, why don't you go get this straight? And 3 times I sent her to the orthodontist, and she just couldn't bear the fact of wearing braces.
Right.
So years went by, and every time I ask her the question, the tears come down, same thing. Invisalign came out, and I started doing Invisalign about 5 years ago. I said, Wendy, I don't know if this is going to work, but if you want to try, I'll try. She says, let's give it a shot. And she wore the braces, and you can see her after.
Her after
I got
is
to tell you, she comes in now, and I ask her, how are you doing, and how do you feel about the appearance of your teeth? She still cries, but now she cries tears of joy. She's just really happy, and she's thrilled, and she should be. And this is years now that she's had this corrected, and it's maintained with her retainers that keep everything in line without them going back, and she looks great.
All right, we have about a minute left in the show, but I want to ask you, when patients come to see you, what do you feel is the most important aspect of the visit?
Well, patients come in, okay, they don't know you, they know they may need some work, that's all they know.
Right.
So you can't just go in and tell them this is what you need and that's it. It's really important to develop some type of rapport with the patient so that they can trust you, so that they honestly will believe, he's telling me this and I believe it because I don't think he would lead me wrong.
Right.
So if you can develop some type of bond with the patient as well as trying to tell them exactly what you think they need to correct everything, I think that's really the most important thing in the first visit.
And doctor, any final thoughts before we go today?
People want to feel good about being in a dental office because a lot of people have fear.
Yes.
And I think my staff, the office, and everybody who makes that experience a positive one makes people leave going, gee, I never thought it could be like this. And they really appreciate the whole package.
Dr. Marc, thank you so much for coming on the show. Dr. Eli,
thank you.
Thank you. Thanks for watching this edition of Leading Experts, everybody. We'll see you next time.